Hello, my name is John. I've been a physical therapist in an orthopedic outpatient setting for over 20 years, working with a lot of spinal disorders and other orthopedic conditions. And the purpose of today's video is I've seen a lot of similar problems come into clinic, which is what I'll be starting a whole series talking about some of the common questions that come up in the clinic. So if you would like this kind of educational content, please feel free to like and subscribe. So today's topic is sitting posture. A person can do all the right back exercises in the world, and if you're not sitting right, you're going to continue to have back pain. It's kind of interesting to think that sitting is that important. In fact, I would say it's probably one of the most important things any of us can do for our back condition. There's a reason behind that. It's taken me years to really figure out what it is. One of the reasons is that it's a mechanical thing. A lot of back pain is mechanical. So when we have our spine, we have these intervertebral discs, okay, which in my kind of poor artistry, you can see why I'm a physical therapist and not an artist. I've drawn a vertebrae, which is bone, so this is bone, and a disc in between. When we sit, slouch, or bend forward, so this is an arrow going forward, okay, when we bend forward, the spinal mechanics of it is it tends to compress the front of the disc, open up the back. You can see there's a distractive force there, compressive front in the middle. And so if I bend the spine forward, it compresses in the front, opens here, which tends to squeeze some of this disc material, we're talking just millimeters, towards a nerve root. Or it can just cause a mechanical distortion in the disc a little bit, and it can be felt as maybe a feeling of tightness or pressure in your back, even if it's not acutely painful. But if this is left to go long enough, it will become acutely painful, or very painful. Now the interesting part is when we're standing, this is a standing position here, disc pressure at the front and back of the disc is fairly neutral. Okay, so when we're standing, standing desks aren't a bad idea. I still think it's a good idea to be able to sit at a standing desk, so I wouldn't make your standing your only position. But when you're standing, disc pressures are fairly neutral. Pressure on your spine is fairly neutral because you're not bending backwards, or bending forward. So we're circling back around to why I'm going to make the recommendations of what I'm going to make with regards to sitting. Personally, if I don't know why I'm doing something, I'm hesitant to follow through. So that's why I'm taking the time to explain this. Is my mind's kind of mechanical, it just has always worked that way, so I want to take time to educate everyone to why I'm making these recommendations. One of the biggest reasons is, like we discussed, taking pressure off our intervertebral discs. We've all heard about people, rupturing discs, herniating discs. Usually discs do something not quite so extreme where there's just a little, I like to say they're swollen. Get a little swelling back here, get a little pressure on some structures that are sensitive, and you start to have anything from back pain, soreness, to tightness, to actual acute pain, and anything in between. So to help when we sit, we tend to want to flex, which increases disc pressure. So when we sit, okay, if I don't have some support, I tend to flex a little bit. Okay, now when I flex, you can see I'm starting to move towards this position. I'm actually starting to bend forward. Okay, I can sit here quite a while, and with my own muscles and just being really aware, I can work really, really hard, and I can keep this inward curve, what we call the lordosis. Lordosis is just this inward curve of our back. Now if I sit here very long, I'm going to eventually start to lose that lordosis, okay, hence putting me more in this position with slightly higher disc pressure. I'll show you a table in a little bit showing disc pressures with regards to a table. So researchers have studied this and repeated it many times, showing that pressures escalate as you flex. And that'll have implications for exercise and other things that I'll cover later in this channel. We'll do some safe weight training recommendations based off of some of these concepts. We're just going to keep building this. So with this lumbar roll, has a strap. This is a McKenzie roll. I like these. I'm not trying to sell these. I don't sell them. I actually give them to people for free when they're getting treatment at my clinic. But if you want one, Amazon sells them. but I don't have any. I am a McKinsey certified provider, but I don't get any financial gain by recommending these. You could use a small throw pillow. I don't usually recommend a towel because a towel's too firm. Most people can't be there very long with a towel because it starts to become uncomfortable. So some kind of a throw pillow, experiment a little bit. If you have something around your house that works, great, use it. I prefer these. Some people find them too big, but find something that works for you. All we're trying to do is get a little support in here. The first step is get your hips all the way to the back. Get this roll in here. Okay, you want it to fit in the curve or the lordosis of your back. And I'm going to sit back into it, get as much of a curve as I can muster or attain, and then I'm going to back out of that a little bit. Maybe, put a number to it, maybe 10% or so. Now, notice when I do that, my neck and my shoulders are in decent alignment. Okay. Now, look at what happens to my alignment up here when I lose my lumbar lordosis, even if I get rid of this roll. Okay, if I lose this curve, I start to slouch. This isn't horrible slouching. It's not like I'm doing this. This is just a little bit of slouching. Now look at how my head's kind of starting to come forward. My shoulders have rounded. I'm getting into kind of a position that over time would cause some mechanical troubles in my spine. Not to mention the strain on the ligaments and the muscles. So again, I'll put this back. Get a big curve, relax out, and I'm not working that hard. My abdominals slightly cubed, and I'm in a pretty good position there. If I still feel like I need to fix my upper body, sometimes, like if I'm at a computer, I'll squeeze my shoulder blades together and then relax. I can lightly pull my chin back and then relax a little bit, and that'll settle me into a pretty good position. So this is, in my opinion, a very good place to be. Now let's say you get tired of sitting against a backrest. Okay, that's all right. You can sit forward. You don't have to use a roll all the time. You can still sit forward, and I can keep my pretty good lordosis even if I had a computer here. A note on computers, get that keyboard right up against your abdomen if you can. If you start to protract your shoulder blades forward or move them forward, your scapula, if they come forward, it'll throw you into that kyphotic position. So we really want that keyboard, close so we're not losing that lordosis. The minute you lose your lordosis, it's like losing the foundation of your spine because your spine starts down here. This is your lumbar spine. The minute you lose that, your thoracic spine or your mid-back and your cervical spine, your neck, you're going to start to curve forward. The minute that happens, it would be the same as building a house, having your foundation being out of alignment, and then you're trying to frame up the walls and put trusses in, and there's no way it's going to work out right because everything's all cockeyed and out of alignment. So if you start with a square foundation, you have your lordosis, the rest of the spine tends to correct a lot of itself. So I can't emphasize enough the lordosis. We talked about disc pressure. Let's go ahead and look at that table for disc pressure real quick. Okay, so this is a table on disc pressure, and as you can see, they actually put little probes inside living people and had them go through different positions. You have basically a person lying on their side or on their back, lying on their side, standing is kind of considered the gold standard of 100% disc pressure. And so this is pressure in between your intervertebral discs. This is the pressure in here. Bending forward, standing, there's implications for this with exercise that should be apparent. I will be covering this with regards to weight training and other things later in my channel. So we'll develop this concept. This is a starting concept. But look at sitting. Sitting goes up. This is sitting straight. This is me sitting straight. It bumps up 40%. Look at this. Sitting puts considerably more pressure on our intervertebral disc than standing does. So it's 40% more pressure than standing. 40% more pressure in sitting as compared to standing on your intervertebral disc. That's sitting in a good position, let alone in a slouching position. If you slouch, it bumps up another 45% roughly. This person, and it's up 85% over standing. So here we are 100, now we're up to 185% pressure here. So sitting, and especially slouching, because sitting is hard on your back, sitting and slouching is even worse. And now that you understand this, you can kind of make sense of why does this happen? Well, when you bend forward, you're putting pressure on your disc, and it's escalating the pressure. It's like squeezing a water balloon. This really is not complicated, material in my opinion. It's just knowing that none of us were ever taught these things. So that's what I'm trying to do, is to help yourself feel better over the long term. Most of us will have trouble over the long term with our intervertebral discs. I've had the pleasure of working with multiple patients over the last 20 years, starting over a whole lifespan. I've worked with younger patients, middle-aged, older people. I've worked with people over time, the same people. Most of us, unfortunately, at some point in our lives are going to have some kind of a back problem. So it's so important that we take care of our backs and we learn how to sit properly. We have to use computers more today. We have to drive. Many of us have commutes. And so I'd like to, if anything is a starting point for these educational discussions, try to sit better. And then, keeping your lordosis, use that as a start. Work on getting your chin back over your earlobes over your shoulders. That's a great starting point. I'm going to have a whole series on standing posture. We're going to talk about that. Positions, like I said, during exercise and weight training. So we're going to keep developing this. And then another thing, sitting. If you're sitting right, that's great. But remember, sitting still puts more pressure on your back than standing, because if we stand, we know that pressures on our spine are lessened. So hey, take frequent stretch breaks. Even though you're going to sit properly, stand up. Go run an errand, take a walk on a break or lunch if you can. Walking is one of the best things any of us can do for our back. We know that walking helps people who walk daily or frequently have less back pain than people who don't. So that's a simple thing that most of us can do, is walk. The other thing is you can do a back bending stretch, offload your spine. If you do catch yourself flexing, correct it. And then when you do stand up, hey, it doesn't hurt a bit to do a few back bends. So offsetting some of those pressures. So just kind of a common sense approach that we can all use to help with back care. I hope this helps. I hope this information is useful. In the videos to come, I'm really going to try to focus on a couple things. One, mechanical things as it applies to the body that you can apply to exercise and to movement. I'll have another video on kind of back mechanics, how to lift and move better, protect your back. We'll have some on exercise, one on the shoulder joint. I want to cover that. So we're going to try to apply mechanics as it applies to the body. And I hope you found this video useful. And I just want to help people have less pain, and for you to have a better life. Hope you're having a great day.